Hi everybody. Now I'm going to show you 3 different ways to work a dysfunction of the SC joint, which is of course so important because that's the only place where your shoulder or your upper quarter is attached to the axis skeleton. So first you want to palpate the most medial side of your clavicle in the inferior direction of the superior aspect of the clavicle. So here's my clavicle. Here's the medial side of my clavicle, but I'm going to go on top of it at the most distal point and press down. It's often helpful to go to palpate it from your opposite side. And if I'm at home, I would just hook my fingers like that as if I was going to grab onto a stone, like rock climbing, and then just kind of pull down. But the angle would be like this, all right? You might know that it's dysfunctional because when you raise your arm up like that, it either is tender to touch just now, or the bone does not move down when your arm goes up, or it hurts, or you might have tested the patient of having weakness in shoulder flexion. So now we're going to treat that in a strain counter-strain approach. I've just cut my finger there so we don't lose track of it. I'm palpating again the left medial clavicle on the superior aspect, facing down. In order to treat it with the strain counter-strain technique, it's very easy. You just bring up a whole bunch of pillows, use the edge of your couch or maybe the headboard of your bed, and so you rotate your head away, and then you're going to flex your head and side bend towards that side, and that point should become less tender. Since I'm using my left hand to palpate, the whole area is a little bit tense, so I'm going to just palpate with my right hand, and it's still a little easier. Now I can see that point should be not tender, and you could just let the whole hand, you don't have to maintain your pressure there, you just have to hang out here for 90 seconds. All right, 90 seconds later, we should be fine. You could get yourself out of that position, palpate again, and most likely that point will feel more comfortable. And then you can reassess to see, oh, is it moving down when my shoulder goes up? Does it feel better? Am I a little bit stronger? The second technique will be using the palpation at the same point. I'm going to use my contralateral hand to palpate because my left hand is going to be moving. So my right hand is palpating the superior medial aspect of the left clavicle. I'm going to lie again in supine, and then just holding that pressure down, I'm just going to move my arm up and down. This is just a mobilization with movement of my left SC joint. And a few times should be in pretty good shape. I might notice I get better range of motion or not. But the key thing that you're looking for is that when you move towards the end of the range of motion, your SC joint should then move inferior. The home exercise program would be the same. Your patient can just do this, or if you have some handy TheraBand, then you can just do that with a little bit of resistance to make sure that it maintains the gain that you just produced.